Hi, I hope you have enjoyed the ICSR BioMed in Singapore so far. I'm Hooman Samani from University of the Arts London, and today I'm going to present our work, Robotic Cognitive Behavioural Therapy, or rCBT, a work with collaboration with University of Hertfordshire and University of Plymouth in the UK, as well as NTU in Singapore. Cognitive behavioral therapy, or CBT, is a form of psychotherapy that aims to reduce symptoms of various mental health condition. Is very standard form of psychology therapy, and people in psychology has been working a lot on that. Is has a lot of research aspects as well as real practical aspects in hospitals. According to literature review in psychology, the general model of CBT looks into the incident which triggers certain situation for the patient from one side, and also looks into the experiences that build beliefs for the patient. And based on that, psychologists explore four aspects of cognitive, affective, psychological, and behavioral situation, and evaluate those and work on those four aspects in order to deal with the patient in order to improve the situation. Even though CBT is very common, it has been successful and has been around in psychology for several years. But it has its own limitations and challenges. We need the therapist to be available for the patient to go to the hospital or to the clinic. And of course, if imagine a person, for example, with depression or anxiety, to encourage them to go there. There are certain limitations. In addition to that, we need the patient to be engaged. We need the patient to have the commitment. Usually, the initial stages of the therapy are very challenging, and during the time the person needs to go back, the task will be assigned to the person and needs to go back to and to do them. So practically, when we start to use the CBT as a method of therapy, it's not very standard, straightforward procedure, and it opens ways to look into alternatives to improve the traditional CBT. So compared to traditional CBT, when there are face-to-face sessions between the patient and the therapist, technology has been used. We call them technology-based CBT. For example, we have computerized CBT, or we call it CCBT, internet-delivered CBT, or ICBT. Also, smart devices has been used. For example, there are certain apps for CBT. We call them app CBT. And also, there are some research for usage of VR, or virtual reality for CBT. We call them VR CBT. In our research, we focus on robotic, and we call it rCBT. For activity, we are basically looking into success of usage of social robotic in healthcare. For example, we have been using robots for autism, and we have lots of success stories there. We have been using robots for childcare or for interaction with elderly. And the embodiment of the robot itself, it would be an extra advantage that it can improve the technological based CBT. And our goal is to see how we can use this embodiment of the robot and interactive aspects of that, as well as the social aspect, to improve what the current technological CBT is working. We have done the literature review on different aspects and applications of CBT, and looked into the possibility of using the robots for that. We started mostly with anxiety and depression. However, we believe that it's possible to extend this work to other aspects of CBT, for example, for insomnia, disorders such as personality disorder or substance use disorder, other aspects such as OCD, PTSD, anger management, and so on. From robotic point of view, the developed system can be extended and hopefully be used for such applications. So we started with design of the robot. We use with a standard social robot application. We wanted something to be interactive, something to be engaging. Also, it needs to have screens in order to show certain information and have inputs and outputs. Also, we wanted the robot to have certain sensors, so that's why we designed some hands for the robot to implement the sensors inside that. After initial sketchings and brainstormings, we improved that, and then We had CAD designs to see mostly the movement of the robots. For usage of that, we looked into general guidelines for designing of the social robots, and also for the development of system, we implemented certain electronics for example, servo motors, LED screens, LED matrix, and so on. And we used that LED matrix to show basic face of the robot. And finally, we did the prototyping. Here's the final prototype, as you can see in the picture. And it's a little robot with two hands. It is not moving. It's a tabletop application. It's quite small. So the idea is that the patient is able to take this robot and bring it to the hospital. And when the tasks are assigned to go at home, they can do it and they can bring it back to the hospital. So this should be a very low cost and affordable system. And this is the overall function of the system. We call it the screen flow. It has 8 different functionalities. First and seconds are basically for emergencies, to log in, log out, and interacting with the system. Also, the patient can use the system for entering their diaries. The daily moods also can be used and also recorded with the system. And they can have on their own mindfulness applications and activities, which the robot is helping them to do that. And of course, it's assigned by the therapist. And also, they have their own calendar and to-do list. So you can see it's kind of embodiment of the standard digital CBT system. And here is the application of the robot. You can see there's a screen. The face is shown on top, shows the motion of the robot. The screen is showing the application. And in this case, you can see that the robot is used to, for example, measure the heartbeat of the patient. And here is a short video that I can share with you the functionality of the robot. As you can see, there is a LED matrix on top with different colors and patterns, and at the bottom there is this LED screen with all the instructions. And robot has 2 hands using 2 simple servo motors, but the main functionality of that is at the end of these hands we are implementing the sensors. For example, you can see here the hands are moving, and also the instruction is given for the person to interact with the robot. And there are, as I explained, for the different flowchart of the menu, for example, here you can see the mood of the person has been recorded over the days. And this is again based on literature on psychology and also consultation with psychologists in the domain of CBT. So every day they can put a number based on the mood that they have on that day, and it will be recorded and will continue. And also they have their own diary, and they can have kind of a journal. This is also a standard form of having the CBT, which robot is helping here. And the idea is that it can improve involvement and engagement of the patient for these recordings. So, as a general conclusion, here we talked about incorporating social assistive robots in CBT is a starting point. The idea is we try to explore what we have done before in social robotics in our community, look into the new domain of CBT, and hopefully we would be able to have more collaboration, working more with psychologists, people in healthcare domain, and also roboticists can improve the interactive aspects of the robot, and we can have new versions and improvements of the work. Of course, it has its own limitation as a starting point, as I mentioned a few times. And in the future, we need to do more user studies. It is its own ethical approvals, and we also need to work on more long-term evaluation of the system and also evolution of the system. And hopefully, we'll have better work of this kind of robots for application of CBT. And hopefully, you can also collaborate. If you are interested in this kind of work, feel free to reach out. And I put my email here. Would be happy to work with other colleagues to improve this very interesting research. Thank you very much and have a nice day. If you have any question, feel free to drop me an email. I would be happy to reply.